All right, so we're back with Ashley, and when you are assessing whether or not you need this taping, I want you to first look at your shoulders. So go ahead and get in front of a mirror, align your shoulders like this, facing the mirror, and you're gonna see which side is lower. So Ashley's left side is higher and the right side is lower. Just by a little bit, you can maybe observe here. Another way to look at it is look at the clavicular angle. So that's where the clavicle or your collarbone meets your sternum. So the normal angle here should be 15 degrees from the medial aspect here where it meets the sternum to the acromion here where it connects to your shoulder complex. This angle here should be 15 degrees. So we look here, that's probably about 15 degrees. But let's look at this side. That's a lot more than 15 degrees, maybe 20 or 25 degrees. So for Ashley, either this side is tight or this side is loose. Now, her right side is actually symptomatic. So that's how we know that the right side is actually lower and the left side is normal for her. So she's got a little bit of tightness back here and a little bit of tension in the arm here. So we want to decrease that tension by doing the taping. So for you, make sure that you're taping the symptomatic side. If your symptomatic side is actually the higher side, maybe you need to loosen the upper trap instead of supporting it. All right, so for the taping, we have a coverall, which you need to protect the skin from the super sticky Leukotape. So this is Leukotape. It doesn't stretch, it will pull hairs out. So you don't want it to be directly on the skin. So we have coverall here. I've already pre-measured it for Ashley. So it's gonna go right from the spinous processes of the spine, or that's the middle right here. And you're gonna follow the belly of the upper trap right along here. And you're going to attach to the deltoid insertion at the humerus here. So that's going to be right after this big deltoid muscle right here. So right here, okay, so that's a pretty good length. So we're going to stick it on. Do you mind lifting this up for me? Thank you. Okay. It's going to go right back here. This right there, perfect. Then I'm going to take this other half off. If I mess up, we're going to cut away and then do it again. All right, there we go. So wrinkles in the coverall doesn't really matter, but it's best to get it as smooth as you can. Don't do a job like this. Okay, so the next part, and probably the most important part, is you want the body positioned in the optimal alignment of where you want it to be taped. So because this shoulder is lower than the left shoulder, we're gonna raise it, so go ahead and shrug. Good. So the belly of the upper trap is gonna contract a little bit. And now we can apply the tape. It's gonna hold the shoulder right in that place. Okay. Start up here. Okay, so I like to anchor it here, and then you rub it a little bit so that the heat actually activates the stickiness a little bit. And then we're gonna apply it all the way down through here. Good, good, good. And you can rip it. Usually you can rip it by hand. Okay. So this is the preliminary layer. We're gonna do one more layer just to give it some reinforcement. I don't really want it to pull too much on the neck because a lot of people have neck instability and it's gonna pull your neck to the side like this. So I'm gonna reinforce it right here, bringing the acromion a little closer to like the T1 and the AC joint here. The SC joint. Okay, there we go. And now you can pull it a little bit tighter. You're gonna bring the skin. You can pull the skin a little bit and then pull it right down. So see how I'm pulling this way, pulling down and then putting it right there. All right, so Ashley's got the tape on. We can see that her right shoulder has leveled out with her left shoulder. That's giving the upper trap some support and not yanking on those neurovascular structures anymore. You can also do it with KT tape, but that's going to be more of a cueing for the upper tract to activate, not really providing a structural support. So we're going to come out with more taping videos. So if you like it, please leave us a like, comment below on what you think. And yeah, check us out on YouTube, Instagram, and also our blog on our website. We'll see you next time.